Okay, so good evening, everyone. Today we will read Veratrum album. So you can see in the pictures, this is the plant of Veratrum album. Okay, so which part of the Veratrum album is used in the preparation of medicine? Can anyone tell? Generally, the rhizome is used in the preparation of medicine. Okay, rhizome and dried root. So you will get question. यहाँ से क्वेश्चन आता है कि वेरेट्रम एल्बम का कौन सा पार्ट मेडिसिन बनाने के लिए यूज करते हैं तो फ्रेश राइजोम मिस राइजोम एंड ड्राइड रूट इज यूज्ड एंड दिस मेडिसिन इज प्रिपेयर्ड अंडर क्लास 4 ओके and this medicine is proved by Dr. Christian Frederick Samuel Hahnemann. So before starting to this medicine, first we will talk about the introduction, which is said by Dr. James Tyler Kent in his book. The name of the book is Lectures on Homeopathic Materia Medica, which was published in 1904, which is containing 187 medicine. कई बार आता है कि lectures on homeopathic materia medica is written by whom? So answer will be J.T. Kent. कई बार materia medica portion से question आता है. Okay. And there is another book is also there. Lectures on materia medica. That is by Carol Dunham. So just try to remember the name of the book because you will get question. Lectures on homeopathic materia medica, which is written by J.T. Kent, and lectures on materia medica, which is written by Carol Dunham. Okay, so just try to remember. Okay, so what Dr. J.T. Kent has said. If we will talk about the Veratrum album, you will be astonished at wonderful coldness running through this remedy. And hardly a group of symptoms will arise without the accompanying coldness. Means Dr. Kent has said that there is no symptoms. There is a rare symptom which is appear without coldness. Means if the symptom will appear, it will be appearing with the coldness. कोई भी ऐसा सिम्टम नहीं है कि कोल्डनेस नहीं होगा. जो भी सिम्टम होगा उसके साथ कोल्डनेस होगा ही होगा. Okay, so this is said by Dr. James Tyler Kane. But this is also known as white hellebore and European hellebore. And this medicine was the first time used when there was a great war of a homeopathy against the other system of a medicine or other system of a treatment was fought and won by a Veratrum album. मतलब पहले क्या हुआ कि देयर वाज अ फाइट बिटवीन बाय अदर सिस्टम ऑफ मेडिसिन जो जैसे एलोपैथी और दूसरे सिस्टम की मेडिसिन है उनके साथ फाइट हुआ एंड वेरेट्रम एल्बम वाज द मेडिसिन वी यूज्ड वेरेट्रम एल्बम ऐसी दवा है जिसको हम उस फाइट के दौरान यूज किए एंड वी वन बिकॉज ऑफ इट्स मार्वेलस इफेक्ट ओवर द डाइजेस्टिव ट्रैक्ट इसका इतना मार्वेलस इफेक्ट है डाइजेस्टिव ट्रैक्ट पे इट इजली वन ओवर बाय द publicly in the potential efficacy of homeopathy and combating all sorts of bowel complaint. Means if the person was suffering from any type of a GI complaint and the patient got cured by this Veratrum album. So this was the introduction, and this point I want to correlate with the organon of medicine, where in the introduction part, where Dr. Hahnemann has mentioned about this medicine. Can anyone tell me to which disease Dr. Hahnemann has prescribed this medicine? Can anyone tell? Name of the disease? कौन सी बीमारी थी? बेरेट्रम एल्बम दिया गया था किस बीमारी के लिए? Can anyone tell? Colicodynia. Okay. Colicodynia was the disease condition. And for that, Dr. Hahnemann has prescribed this Veratrum album. In which year this medicine was prescribed? क्वेश्चन आता है कौन से ईयर में डॉक्टर हैनमैन ने इस मेडिसिन को दिया था और इस बीमारी के लिए. यहां से एक क्वेश्चन ये हो गया क्यू पॉइंट एंड अनदर क्यू पॉइंट है विच ईयर. कैन एनीवन टेल? 1797. In 1797, the person were suffering from the colicodynia, and Dr. Hahnemann has prescribed this medicine, Veratrum album, and that patient got cured. Okay, just try to remember because you will be getting question. यहाँ से question कई बार आते हैं. Okay, organ of medicine में आएगा. Okay. And this medicine is having a violent mania is there. Why there will be a violent mania? Because of cerebral congestion is there. We find that Veratrum album there is an outburst of a violent mania like belladonna. We will find. And what the patient will do? He will try to tear the clothes. He will try to destruct the things. कुछ भी होगा, काट देगा, फोड़ देगा, फाड़ देगा. This type of mania you will find in this Veratrum album. And another medicine is also there for the destructive mania. That is tarantula. But if you are talking about destructive mania, another medicine is also there. That is belladonna. He is having so much violent destructiveness is there. He want to destroy and cut and tear clothes from his body. But Dr. N.M. Chaudhary has said in his books Systematic Materia Medica that was published in 1916. He said that phenomena like these are often generally caused by suppression of catamania. यदि catamania का suppression होता है, then the patient is having a destructive type of mania is there and violent mania is there. This was said by Dr. N.M. Chaudhary. Okay. And this medicine is commonly known as white hellebore and Hilol. And I have already told the name of the prover, Dr. Christian Frederick Samuel Hahnemann. And this medicine is prepared under class 4. तो यहाँ से क्वेश्चन आता है कि वेरेट्रम एल्बम कौन से क्लास में प्रिपरेशन होता है? So answer will be class 4. And who has proved this medicine? Dr. Christian Frederick Samuel Hahnemann. And what is the other name of Veratrum? So white hellebore, Hilol. But this point I want to correlate with the another medicine. If the green hellebore is there, okay. So which medicine? Can anyone tell? Which medicine is known as green hellebore? Veratrum
Veratrum
viridi.
viridi.
Very good, Ina. That is Veratrum viridi. Very good. But I was talking about the destructive mania. At that point, again, we can correlate with the organ of medicine with aphorism number. Can anyone tell where Dr. Hahnemann has advised or talked about mental disease? Can anyone tell? डॉक्टर हैनमैन ने मेंटल डिजीज के बारे में किस एफोरिज्म में बोला है? कोई बताएगा?
सर 210 to 230.
वेरी गुड अमित. 210 से लेके 230 में डॉक्टर हैनमैन ने मेंटल डिजीज के बारे में बताया. तो ये क्वेश्चन कई बार आता है. ओके, वेरी गुड सोनू. For children and old people, these extremes of life, person who are habitually cold and deficient and vital reaction, young people of a nervous sanguine temperament. Suppose if the patient is coming to you and they are having a cold, old person or children is there, and if they are having a vital force deficient, and they are having nervous sanguine temperament. Sanguine temperament means it is related with the blood. A plethoric congestion you will find, especially in young person. Then we can think about this medicine. But there is written vital force or vital reaction deficient. This point again we can correlate with the organ of medicine. So what can be the qualities of vital force? Can anyone tell क्या क्या qualities होते हैं vital force के? Can anyone tell?
Automatic.
Yes.
Unintelligent, autocratic, or
Yes. Very good, Aryan. And spiritual, autocratic, autocratic, dynamic, unintelligent. Very good. So these are the qualities of vital force. And sometimes we will get question. कई बार यहाँ से question आता है कि क्या क्या qualities होते हैं vital force के. तो you have to remember all the points. Okay. Don't forget. Okay. Okay. Again, deficient vital force. This point again we can correlate with the aphorism number. where Dr. Hanman has advised about the hyposusceptibility, where there is a benumbed state is there. So which medicine was prescribed and where it is mentioned in aphorism? Can anyone tell? किस एफोरिज्म में डॉक्टर हैनमैन ने बिनम स्टेट के बारे में बोला है या हाइपोससेसिबिलिटी के बारे में बोला है? कैन एनीवन टेल? ऑर्गेनल ऑफ मेडिसिन में
aphorism 183 and footnote में opium prescription is मतलब suggested.
Okay, very good, very good, very good, Ina. So this was mentioned, especially in the footnote of 183, where Dr. Hanman has advised in the benumbed state we can prescribe the opium. Okay, and that condition, कई बार होता है क्वेश्चन चेंज हो सकता है, benumbed state ना बोल के hyposusceptibility it can be asked. Okay, so again we have to prescribe this opium. Okay. Adopted to diseases with rapid sinking of vital force, complete prostration and collapse is there. Why? The person is having a rapid sinking of vital force because this Veratrum album patient is suffering from the cholera, a severe type of cholera. If the patient is having cholera, so what are the other symptoms? Like vomiting will be there, diarrhea will be there, and because of so much diarrhea, so much vomiting, it will lead to the weakness of the whole body. It will lead to the dehydration of the whole body. And if it will lead to the collapse of the whole body, you will find. And if there will be so much dehydration, so there will be a low blood pressure because of there will be a problem which is related with the low electrolyte imbalance. अगर सोडियम पोटेशियम की कमी हो जाएगा तो क्या होगा? लो ब्लड प्रेशर भी हो जाएगा. And that's why you will find there will be a coldness of the whole body you will find. And the patient will be having a sweating, so you will find cold sweat over the forehead. इसलिए क्या होता है उसका forehead पे cold sweat होता है. And if you're talking about the cold sweat over the forehead, so can anyone tell me the different medicine for these symptoms? और क्या क्या medicine है? There are medicine about the cold sweat. Carbolic acid is there, camphor is there, Valeriana is there. But in Valeriana, you will find there will be a coldness over the vertex. And sepia officinalis is also there. Okay. But if you are getting the coldness over the entire body, so what can be the name of medicine? What can be the medicine? कौन सी medicine है जिसमें entire body में coldness है? The medicine is
Tabacum.
Yes, very good. The medicine is tabacum. Okay. But this point I want to correlate. Like if there is a coldness, but we can correlate one hand icy, other warm. What can be the medicine? क्या medicine है? One hand icy and other warm. What can be the medicine? Like cinchona is there, and distalis is there, and dipicac and pulsatilla is there. Okay, pulsatilla. But one foot hot and other cold. So we can talk about the medicine that is lycopodium, and distalis, dipicac and pulsatilla is there. Okay, so just try to remember the whole symptoms. Okay, but if there is a sweating, okay, if there is a sweating half of the face, so can anyone tell me the name of medicine? फेस के एक साइड में स्वेटिंग होता है. Which medicine? The medicine
Sir,
is
pulsatilla.
Yes, very good, Amit.
Pulsatilla.
Very good. Pulsatilla is the medicine. Very good. Excellent. And thinks she is pregnant or will soon be delivered. You can see in the picture, the patient is thinking that I am a pregnant and I will be going to deliver a baby. But sometimes this point we can correlate with the gynae and obs. If the patient is feeling like that, what can be the condition? False pregnancy को क्या बोलते हैं? Can anyone tell?
Pseudocyesis.
Yes, very good, Aryan. That is pseudocyesis. Very good. ये क्वेश्चन आया हुआ है. ओके, pseudocyesis किसे बोलते हैं? फॉल्स प्रेगनेंसी को. ओके, फॉल्स प्रेगनेंसी को. false pregnancy. Okay. And attacks of fainting from the least exertion and excessive weakness. Why the patient is having a so much fainting? Because I have already said, if the person is suffering from the severe cholera, if the patient is having cholera, so there will be a vomiting, so there will be a diarrhea, and that will lead to the severe dehydration. And the severe dehydration will lead to the weakness of the whole body. And because of weakness of the whole body, the patient may faint. Then we can think about this medicine. But if the patient is having a so much bleeding, hemorrhage is there, amenorrhea is there, and the patient is having a fainting, then we can think about the medicine that is Veratrum, and that is also known as trillium pendulum. अगर मेनोरेजिया या ब्लीडिंग की वजह से फेंटिंग हो रहा है, so we can think trillium pendulum. Okay. Mania with desire to cut and tear everything, especially close with lewd, lascivious talk, amorous or religious. What I have already said. Like there is a person, if we will talk about the mental symptoms, okay, mental symptoms which is mentioned in the J.T. Kent, name of the book is Lectures on Homeopathic Materia Medica. The mental symptoms are marked by the violent and destructiveness. He wants to destroy and tear something. He tears the clothes from body. Always want to be busy and carry on his daily work. Why this patient want to be busy? क्यों ये पेशेंट बिजी रखना चाहता है अपने आप को? बिकॉज इफ ही विल बी नॉट बिजी, अगर अपने आप को बिजी नहीं रखेगा तो व्हाट ही विल डू? ही विल ट्राई टू टीयर ऑल द थिंग्स, ही विल ट्राई टू डिस्ट्रक्ट ऑल द थिंग्स. And that's why this patient, what the patient will do? He will try to put the chair one after another. एक chair के ऊपर एक रखता है. Once you will ask what you were doing, then he will say कि I am pile up of this chair or step, मतलब vertical में खड़ा कर रहा हूँ. Why? Because if he will be not occupied, he will be distract the things, and he will pray for a long hour, because this patient is having a mania. So he will either distract, either he will pray for a long hours. He will sit in the masjid, he will sit in the temples, and he will start praying for a long hour. Or either he will sit very quiet. You will find both things. Sometimes you will find disposition to silence is also there. एकदम शांत बैठ जाएगा कभी कभी कभी, एंड कभी कभी ऐसे प्रे करेगा, हरे रामा हरे कृष्णा हरे रामा. Why? Because this patient is having a religious mania. For religious mania there is another medicine is also there, that is thorn apple, that is stramonium, and that is surukuku, that is lachesis mutus is there, where religious mania is there. And you will find destructive mania is there, Veratrum album and belladonna is also there, destructive mania, and tarantula is also there. Okay, so just try to remember, and you will find lascivious mania is also there. He will be always thinking, if some girl is passing in front of him, अगर उसके सामने से कोई लड़की चली जाए,
वो
कितना
फिर
आनंद आ
बात
रहा
है
है.
क्या अभी नीचे का कर दे मैं ठीक 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 दे रहा हूँ मैं दे रहा हूँ
अमित म्यूट करो माइक. Okay, so if some girl is passing in front of the patient, he will starting, हाँ अगर इसके साथ सेक्स करूंगा कैसा लगेगा, ओ बहुत आनंद आएगा. He will think that I want to kiss, if I will kiss I will feel much happy. That is a lascivious talk you will find. He will be always thinking about the sexual thought, amorous is there, sexually he is thinking. And these symptoms we can correlate with the another medicine, that is hyoscyamus. And Alzheimer's, suppose if the patient is admitted in the IPT, so what she will do? That lady, she will try to attract you. So she will uncover that knee or thigh of the thigh. She will uncover the thigh portion to attract his doctor. That is a lascivious mania, which is also mentioned in Alzheimer's. Okay, so you can see how these boys are reacting over the girls. You can see how they are reacting. While looking this picture, you will understand this patient is having a lascivious mania. इतना ख्वाब सजा लेगा, हाँ, कितना आनंद आ रहा है, कितना आनंद. Okay, so this we have to remember. ये आपको याद रखना होगा. Okay. Sinking feeling during hemorrhage. You can see there is a hemorrhage and the patient is feeling something is losing. Why? Because he is feeling so much weakness. And fainting during hemorrhage, I have already told trillium pendulum is there. And sensation of lump of ice on a vertex with chilliness as of a heat and cold at same time scalp as if brain were torn to the pieces. Why this patient is having a sensation of coldness? Because I have already told if the patient is suffering from severe cholera, then there will be a vomiting and there will be a diarrhea that will lead to the severe dehydration. There will be a problem related with the electrolyte imbalance, sodium or potassium. So there will be a low blood pressure. So the patient will be always feeling. अगर जिसका blood pressure low होगा क्या, अरे चक्कर आ रहा है, the patient will say चक्कर आ रहा है. Fainting will be there. Fainting. Okay, so we have to keep in mind, and that's why this patient is feeling, मेरा सर फट रहा, brain फट रहा. The patient will be saying, but these symptoms we can correlate with the another medicine. Can anyone tell in which medicine this is mentioned? Especially in case of a headache. Can anyone tell? Headache, especially in the morning and commencing in the morning. While ironing, the patient says that it will break into
Brania.
the pieces. Yes, Brania is the medicine. Very good. But if you are talking about the sensation of eyes on vertex, these symptoms we can correlate with another medicine. If there is a burning on the vertex feeling is there, burning on vertex, which medicine? Can anyone tell? Burning,
Sulfur.
yes, sulfur, very good Aryan. And उसके
Graphitis,
yes, graphitis, and one more is there.
calcarea,
Yes, calcarea car, very good Ina, very good. And lachesis we can also think. Okay, another symptoms: pale face, blue, collapse, feature, sunken, Hippocratic, red while lying and becomes pale on rising up. Why this patient is having a face pale and blue? Because I have already told if the patient is having a so much discharge is there, hemorrhage is there, hemorrhage, and that will lead to the hypovolemic shock, that will lead to the hypovolemic shock, that will lead to the low blood volume in the body, and because of that you will find there will be a paleness over the face. And why there is a sunken face? Because there will be a hampering of the blood circulation, and there will be a not proper supply of the blood or oxygen, and that will also lead to the cyanosis. That's why there will be a bluish discoloration and blue color of skin you will find. And thirst intense, unquenchable for large quantities of a very cold water, acid drinks, and wants everything cold. Why? Because there is the dehydration. That's why this patient is having a so much unquenchable thirst. If the patient is drinking a large amount of water, 4 से 5 लीटर भी पिला दो तो उसको मम्मी पानी और चाहिए unquenchable. If the word is mentioned unquenchable means he will not satisfy while drinking the water 4 to 5 liters. Why? Because this patient is having a severe dehydration. That's why he wants more water because डिहाइड्रेशन इतना हो जाता है कि उसको वाटर चाहिए, इसलिए उसको अनक्वेंचेबल. बट दिस सिम्टम्स I want to correlate with the another medicine. Burning thirst for a large quantities of cold water. Which medicine? Can anyone tell?
Brania.
Not Brania. If you are saying Brania, let me tell you. There is mentioned great thirst at a long interval. That word is mentioned. That is Brania. But
Aconite.
yes, very good, Aryan. That is aconite. But I am asking the another symptom. Thirst for large quantities of cold water. Which medicine?
Rustox,
Not Restock. That is Podophyllum. And same symptom you will find Sencris सेंक्रिस कंटोट्रिक्स। ओके, स्नेक रेमेडी है ये, यहाँ पे भी मिलेगा। सेंक्रिस कंटोट्रिक्स यू विल फाइंड इन द बोरिक मेटेरिया मेडिका। ये लिंक ओवर होने वाला है, उसके बाद अगेन आपको ज्वाइन करना है ये, ठीक है, सेम लिंक। But here mention wants everything cold. This point again I want to correlate with the another medicine. Craving for ice. Craving for ice. Craving for ice. Which medicine?
Madurinum.
Yes, very good, Amit. Medorinum, and one more is there.
Radium brome.
Phosphorus.
Yes, very good. Radium brome and Medorinum. These are the two medicine where there is a craving for ice is there. But if you are saying phosphorus, phosphorus we can think desire for the cold things. But especially if there is a craving for ice, only two medicine we have to keep in mind. That is Medorinum and radium brome. Okay. Surgical shock. Surgical shock, like I have already told, like if there is a operation or if there is a loss of so much blood, hemorrhage is there, that will lead to the hypovolemic shock, and that is known as surgical shock. Okay, and if you're finding this type of condition, then we can think about Veratrum album. Another medicine we can also think at the last stage of our life, the medicine is vegetable charcoal, that is known as carbo waste. Okay, just try to remember. But here the word is mentioned surgical. Okay, this point I want to correlate with the organ of medicine where Dr. Hahnemann has told about the surgical cases we should prescribe the medicine internally. कहाँ पे हैनमैन ने बोला है? Can anyone tell?
Aphorism 184.
186.
186.
Yes, very good, Hina. That is 186. Okay. Very good, excellent. Where Dr. Hahnemann has advised if there is a fracture of any bone is there, we can externally use the plaster, but internally we can prescribe our medicine like homeopathic medicine. So just try to remember this point, okay? But here the word is mentioned, shock. Shock, we can correlate with the surgery subject. What is the meaning of shock? Means if there is a hypoperfusion of the tissues, that condition is known as shock. Just try to remember, don't forget, okay? And you will find excessive dryness of all the mucous surfaces. Why? Because there is a severe diarrhea, severe cholera is there, and severe vomiting will be there, and that point will lead to the excessive dryness of the all the mucous surfaces there. Okay, so we can think about this medicine, and this point we can correlate with the another medicine where you will find that dryness of mouth is there, so much dryness is there, the tongue will adhere to the soft palate. इतना ड्राई हो जाता है, इतना ड्राई कि टंग जो होता है सॉफ्ट पैलेट में चिपक जाता है. The medicine is nutmeg, which is also known as nux moscata, and which is belonging to the myristicaceae family. Okay, so just try to remember. We are so many. We have talked so many times cholera. Okay. This point I want to correlate with the park. Okay. Park means preventive and social medicine. Okay. That cholera is caused by bacteria. The name of the bacteria is Vibrio cholerae. कई बार क्वेश्चन आता है, आइदर बैक्टीरिया होता है, वायरस होता है, तो फर्स्ट बैक्टीरिया होता है एंड विब्रियो कॉलरी होता है. ओके, बट which disease is known as public health disease? Can anyone tell? This cholera is known as public health disease. Just try to remember, okay? Sometimes you will get question. And delusion of impending misfortune. The patient is thinking that something bad will happen, something bad will happen. ऐसा लगता है दुर्भाग्य भ्रम सब कुछ एकदम उल्टा होगा, ऐसा मेरे साथ गड़बड़ होगा. Why? Because this patient is suffering from the severe dehydration, severe cholera is there, and because of that patient will be thinking that something bad will happen. And mania with desire to cut and tear, you will always think that this patient is having a destructive mania is there, he will try to cut and tear. But this word I want to correlate with the Kent repertory. Okay, Kent repertory, the Kent repertory were for the first time published in which year? कौन से ईयर में पहली बार आया था Kent repertory?
1897.
यस 1897। और 1797 में क्या मैंने बताया? कैन एनीवन टेल?
Treatment of cholera.
Treatment of Collicodynia by Veratrum album, and this was prescribed. Very good, Sonu. This was prescribed by Dr. Hahnemann in the year 1797. तो first publication 1897 में आया Canterbury का, second 1908, okay, and third 1924, and fourth 1935, and fifth 45, and 57, and 61, and 74. Just try to remember. So under mind section there is a rubric. Under the mental symptom, under the mind chapter, you will find there is a single rubric. Try to tears and try to tears his body. अपने बॉडी को नोचेगा एंड फाड़ेगा. Which medicine? Single medicine है under mind section. Can anyone tell?
Lysine.
Not lysine. Lysine में desire to cut
हाँ.
others. Okay. दूसरे को का कुत्ता क्या होता है? दूसरे को हाँ हाँ. तो ऐसे वो लाइसिन होता है जो दूसरे को काटता है. लेकिन ये जो पेशेंट है अपने कुर्ते को ही, अपने कपड़े को ही फाड़ेगा और टीयर करेगा. The medicine is arsenic album. Okay.
Arsenic.
Yes, very good, Ina. The medicine is arsenic album. Okay. But in mind chapter of Kent repertory, how many rubrics are there? 527. यहाँ से क्वेश्चन आता है. ये क्वेश्चन आता है रिपर्टरी से. ये क्वेश्चन आता है कि कौन से ईयर में हुआ. ऑर्गेनेंस से ये क्वेश्चन आएगा. और यहाँ से सिंगल मेडिसिन अगर उस रूब्रिक के अंदर है तो आर्सेनिक एल्बम का क्वेश्चन आ सकता है. ओके. Coprophagia, violent mania alternate with the silence and refusal to talk. What I have already said. Why this patient is having a violent mania and why this patient is sometimes silence and refusal to talk. Coprophagia means वो patient जो खुद ही हगेगा और खा लेगा. The patient is passing his own stool and he will eat own stool. The patient is passing a stool and he will eat own stool. अपना stool pass किया और गप से उठा के खा लिया, जैसे लग रहा हो रसगुल्ला. Oh, okay. So this is the meaning of coprophagia. You can see how the dog is eating his own stool. So you will find in the patient, ये patient में मिलेगा. Okay, coprophagia. And this is the rubric you will find under the Kent repertory, under the mind section. You will find direct rubric है. Coprophagia direct rubric and single medicine is Veratrum album is there. Okay. ये याद रखना है. Just try to remember. Okay. And this patient is silence and refusal to talk. Why? Because the patient is suffering from severe cholera and severe dehydration is there, and dehydration will lead to the great prostration, great weakness of the whole body. इतना कमजोर हो जाएगा. बाबा तुम बात मत करो, मुझे एकदम छोड़ दो, अकेला छोड़ दो, मुझे बात ही मत करो. So that's why this patient want to silence sometimes and sometimes he refuse to talk. But here the word is written, refuse to talk. This point again I want to correlate with the another medicine. If there is a medicine, refuse to take medicine. This is mentioned single rubric under the Kent repertory. Kent repertory में single medicine, single rubric के अंदर single medicine है. कौन सा है? Can anyone tell? Refuses to take medicine. रुब्रिक का नाम है
Hyoscyamus.
Yes, very good. Hyoscyamus is the medicine. Very good. कई बार ये क्वेश्चन आता है, refuses to take medicine, and this was the question has been asked in the AIAPGET. Okay, and UPPSC के एग्जाम में भी आया था 6 months before. Okay, so ये याद रखना. Okay, and sometimes this patient is roaming here and there in the home, here, without any aim, without any intention, without any target, without any destination. He will be roaming. This patient is roaming, and this point we can correlate with the another medicine. If there is an irresistible desire to roam or wandering away from the home, especially in the night, can anyone tell me the name of medicine? Elatrium is the medicine. Elatrium is the medicine where you will find the boric materia medica. The patient is having an irresistible desire to wandering from from home at night. Okay, but this point again I want to correlate. Here the aimless word is written. This point I want to correlate. Okay, so I was correlating with the word aimless. This point I was correlating. Suppose if there is a patient and the patient is having hurried manner without aim, means aimless hurried motion is there. So what can be the remedy? Can anyone tell? Lilium tig is the medicine, okay. But if the patient is having a hurried rapid manner, so we can think about that is argentum nitricum, okay. Cough comes on from drinking especially a cold water. Urine escape when coughing. When the patient is coughing, while coughing, at that time there is a passing or drilling of the urine. So we can correlate with another medicine. Can anyone tell for this symptom what are the medicine?
Causticum and Atramure.
Causticum, natramur, pulsatilla is there. Rumex is also there. Okay, so these are the medicine, and this cough on entering warm room from cold air. The patient is coming from the outside. If the cold is there, and he will be entering into the warm room, so he will start he will start coughing, coughing, coughing. Then we can think about this medicine. Veratrum album is the medicine. You can see in the pictures. Sexual mania precedes menses. Miss, if we will talk about the sexual sphere means this, there is a violent sexual mania which is characterized by the lasciviousness and resulting in either nymphomania if the female patient is there, nymphomania, but if the male patient is there, so there will be a satyriasis, and there will be so much sexual excitement that will lead to the menses. But at menses you will find this is okay. So sexual mania precede the menses. Okay, menses के साथ sexual desire भी होगा. And this point we can correlate with the tarantula. In tarantula you will find the same thing. But if the old age patient is there, okay, old age patient is there, and if the patient is suffering from the chronic bronchitis, so we can think about this medicine. But this point I want to correlate with a respiratory system practice of medicine. So there is a one index that will increase. Can anyone tell me the name of index? कौन सा इंडेक्स होता है जो बढ़ जाता है इसमें? रीड इंडेक्स, ये क्वेश्चन आता है, ओके, एक बार देख लेना. रीड इंडेक्स इट विल ऑलवेज इंक्रीज इन केस ऑफ अ ब्रोंकाइटिस, एंड क्रॉनिक ब्रोंकाइटिस के केस में ये इंक्रीज हो जाता है. ये क्वेश्चन आता है, ओके, सो याद कर लेना इसे. Tobacco hurt from chewing. Suppose those people who are having a tobacco chewing, and if they are suffering from any kind of heart problem, then we can think about this medicine. And one of the best heart stimulant in homeopathic doses. Suppose if you want to prescribe, the person is suffering from any kind of heart problem, so we can prescribe this medicine. But there is another remedy which is known as heart tonic. Can anyone tell me the name of medicine? कौन से मेडिसिन को हार्ट टॉनिक बोलते हैं? हार्ट टॉनिक, हार्ट टॉनिक किस मेडिसिन को बोलते हैं? That is Crataegus. Crataegus is the medicine. Crataegus oxycantha is the medicine. Okay, where the mention heart tonic. Okay, heart tonic is there. Okay, heart tonic. This is heart, a heart tonic, Crataegus oxycantha. Okay, and this is said by J.S. Mitchell. Okay, whatever we have read, and you will find there will be a wrinkle of the skin, hands and feet. Why this patient is having a wrinkles? Because that severe dehydration will lead to the wrinkle of the hands and feet, and you will find there will be a coldness of the whole body. So we can think about this medicine. Okay, And this is the mnemonic. We can remember the Veratrum. Okay. So first you can see the vitality exhaust. You can see in the picture, this picture, the vitality of the patient is exhausted. Okay. Excessive discharge is there. It can be like leukorrhea, I have mentioned, hemorrhage, and what can be the discharge. So discharge is there. That discharge will lead to the weakness. Okay. Refreshing desired things. Okay, you can see there is a pineapple and desire refreshing things or juicy fruity things. Okay. Asiatic cholera. Okay. Asiatic cholera, you can see the Vibrio cholerae is there in the picture. Okay. Thirst for cold drinks and ice. You will find, you can see cold and ice in the picture. Okay. And T for thirst. Okay. R for red face become a while and lie down. Why? Because there is a hemorrhage and that will lead to the hypovolemic shock. That will lead to the low blood volume in the body. And that's why this patient, when the patient is lying, so there will be a pale, and sometimes you will find the blue color of skin you will find. U for uncommon peculiar symptom, that is cold perspiration. You can see here the on shoulder there is a sweating is there. Okay. And M for mania is there and religious mania is there. Okay. So you can see in the pictures and there is a written V for vitality, E for excessive, R for refreshing, F for Asiatic, T for thirst, R for red face, U for uncommon, and M for mania. Okay. Just try to remember. Okay. Don't get confused. And now we'll talk about the relation after arsenic and arnica, cinchona, cuprum, ipecac, we can think, okay, especially in case of Asiatic cholera, okay. And after camphor in cholera and cholera morbus, we can prescribe this medicine. But if you're talking about the cholera, so can anyone tell me what is the trio of cholera? Trio of cholera क्या है? Can anyone tell? हैनमैन ने जो बताया trio of cholera, can anyone tell? Trio of cholera. Cuprum is there. Okay, cuprum. Camphor is there. Okay, camphor. Veratrum album is there. Okay. कई बार क्वेश्चन आता है. Very good, सोना. सोनू. Very good. So Veratrum album is there. Okay. So ये try of एनिमन है. कई बार क्वेश्चन आता है. Okay. Try of होगा. All the symptom is all the medicine which is related with the Asiatic cholera except करके क्वेश्चन आता है. कुछ भी मेंशन कर देगा. आर्सेनिक मेंशन कर देगा या सिकल कॉर. Okay, so we have to choose the trios of medicine. Okay, this is the trios of cholera, cuprum-mate, camphor, and veratrum album. Okay. After ammonium carbobase and bovista, especially in dysmenorrhea and vomiting and purging, we can think, and there is aggravation, especially after drinking and before and during menses, then we can think about this medicine. And if there is so much perspiration is there, then again we can think. And after fright, if there is aggravation, then we can think about this medicine. And often remove the bad effects of excessive use of alcohol and tobacco. जो लोग बहुत ज्यादा खाते हैं दारू and tobacco, so we can prescribe this medicine. Okay. And these symptoms we can correlate with the caladium, where there is mentioned destroys the craving for tobacco. Oh, okay. Destroys the craving for tobacco. So now we will read another medicine, that is Valeriana. You can see in the picture. So can anyone tell me what is the common name of this medicine? Can anyone tell? This medicine is known as Valerian, and this medicine Valeriana officinalis, you are saying green hellebore, Sonu. That is Veratrum viridi. Veratrum viridi को बोलते हैं. ये Valeriana officinalis है. So which part of this plant is used in the preparation of medicine? Generally rhizome and root recently dried. Dried recently root we will use, and this medicine is prepared under class 4. इस medicine को class 4 में बनाते हैं. इसका rhizome and root ड्राइड रूट रिसेंटली जो पार्ट होगा उसको यूज करते हैं दवा बनाने के लिए. एंड दिस मेडिसिन commonly known as valerian, and this is belonging to the valeriana family. Okay. And heal all, this is also known as, okay. And एक बार आप लोग वेरेट्रम में चेक कर लेना, वेरेट्रम का शायद हील ऑल बाय मिस्टेक वो लिखा हुआ है, व्हाइट हेलीबोर ओनली है, हील ऑल शायद मिस्टेक है, वो चेक कर लेना आप लोग। ओके, हील ऑल इज द कॉमन नेम ऑफ दिस वेलेरियाना। ओके, and this medicine is prepared under class 4. Okay, excessive nervous excitability, hysterical nervous temperament, person in whom the intellectual faculties predominant and changeable disposition. Means excessive nervous excitability means the patient is so much excited. Oh, cricket match जीत गया, जीत गया, जीत गया. The patient will be sometimes hysterical. Nervous temperament is there. If the word is mentioned hysterical, sometimes he will start. Sometimes, yes, we won the match, we won the match. Sometimes the patient is so much excited, and that patient is very intellectual, and you will find changeable disposition is there. Sometimes the patient is crying, sometimes the patient is happy. But this temperament, I want to correlate. There are four types of temperament. Sanguine is there, which is related with the blood, and those people warm-hearted is there. Then we can use the sanguine word. गरम दिमाग जिसका होता है, ठीक है, खून गरम होता है ना कुछ लोग का, तो sanguine temperament we can use, and choleric we can use. Those people are very quick to act, मतलब perception उनका बहुत तगड़ा होता है. So we can use the choleric temperament which is related with the yellow bile and which is related with the phlegm. Those patient are cool, calm, शांत, गाय की तरह होता, शांत होता है. That we can correlate with the phlegm, and that is a phlegmatic temperament. And that patient, melancholy, those who are sad, depressed, that is related with the black bile, anxious, fearful, they are melancholy temperament. यहाँ से कई बार क्वेश्चन आता है. ओके, जस्ट ट्राई टू रिमेम्बर. Red parts become a white. You can see there is a red part and sometimes it become a white. Then we can think about this medicine. And this medicine is having a feels light as if floating in the air. ऐसा लगता है कि हवा में उड़ रहा है, चल रहा है. Then we can think about this medicine. In the bracket you will find two medicine like Asarum europeum is there and Lac caninum is there. But if the patient is feeling my legs were floating in the air, then which medicine? Can anyone tell? ऐसा लगता है if the legs were floating in the air, which medicine? The medicine is Sticta pulmonaria. Okay, Sticta pulmonaria is the medicine. But if there is a sensation as if my legs were made up of wood, it will break easily. Can anyone tell me the name of medicine? उसको लगता है उसका पैर लकड़ी का बना होता है. Yes, very good. Thuja. Oversensitiveness of the all senses, you can see tongue, nose, ear, eyes, hand, touch. Okay, so all the senses are very sensitive, and sensation of coldness, great coldness in head you will find. So we can think already we have talked about while we were reading the Veratrum album. Okay, and on the vertex you will find there is a medicine. Sepia and Veratrum album is there. Okay. Child vomits curdled milk in large lumps, same in stool as soon as it has nursed. After the mother has been become angry, you can see if the mother is becoming so much angry, so the child will vomiting. But what type vomiting you will find? Curd like vomiting you will find, and there would be a large lumps, and similar you will find as in the stool. जैसे वो पैखाना करता है उसमें मिलेगा, similar उसके vomiting में भी मिलेगा. At this point we can correlate with the another medicine. Suppose if there is a vomiting, especially large curd like and which is cheesy like, then we can think about the medicine especially adopted to the children who cannot digest the milk. The name of the medicine is Ethuja sinapium. Okay, very good, Arti. Sciatica, pain, aggravation when standing and letting foot rest on the floor, and when straightening out of limb during rest from previous exertion, amelioration from the walking. You can see The patient is lying, he will be resting the foot on the floor and he will straight the limbs, especially. But this patient is getting relief by walking. And from walking, we are talking. So, what can be the another medicine? और क्या क्या मेडिसिन है जिसको वॉकिंग से आराम मिलता है?
Restox.
Yes, very good. Restox and Veratrum album is also there. Okay, Veratrum album. Pulsatilla is also there. Okay, so these are the medicine, and this medicine Valeriana is also there, where the patient is getting relief by walking. Okay, hysteria, oversensitive and nervous affection when apparently well chosen remedy fails. Suppose if the patient is coming to you and that patient is very sensitive and that patient is having a involvement of the nervous affection, and if we have prescribed on the basis of totality of symptom but that medicine is not working, हमने symptom similarity के बेस पे दवा दिया है और वो वर्क नहीं कर रहा है, fail, then we can think about this medicine. And you can see in the picture there is a hysterical spasm and affection. Generally you can see if you're finding spasm, then we can think about this medicine. But if there is at this point, we can correlate. If there is a paralysis, especially on the right side of the body, then we can think about this medicine, causticum. But spasm, we can also correlate. If there is a spasm of the intestine, of the stomach, then we can think about the medicine that is MAC-FOS is the medicine. Okay. Earache from exposure to drops and cold. Okay, suppose if the patient is coming to you and that patient is coming, doctor साहब काने बताओ कान में दर्द हो रहा है, then he will ask क्या ठंडा लग गया था? Yes, when there is a cold, after that I am suffering from this kind of problem, then we can think about this Valeriana. Another medicine we can also think, that is herself. But herself, mentally or physically, they are very sensitive and the patient is so much violent is there. Herself, violent is so much there. कैसा उसका इम्पल्स होता है? इम्पल्स इतना होता है कि ही विल किल यू, लाइक इफ यू आर गोइंग टू द बार्बर शॉप, जैसे नाई के दुकान में जाते हो तो फर्स्ट यू हैव टू कंफर्म दैट वेदर दैट बार्बर वन इज नॉट अ हिपसल, अदर क्या होगा, ही विल कट हिज पैट्रोन्स थ्रोट, जो भी ग्राहक जाएगा उसका गला काट देगा. दैट इज द इम्पल्स ऑफ हिपसल which is mentioned in the lectures on homeopathic materia medica which is written by James Tyler Kent. But एक impulse इसका हो गया जो गर्दन काट देगा. लेकिन this point I want to correlate with the another medicine, that is iodine. Iodine patient will kill you without any intention, without any problem, without any cause, without any justice. He will kill you. There is no problem with you, but he might kill you because of impulse. Because of impulse, he will kill you. That is iodine, and iodine is having a craving. Why this patient is having craving? Why this patient is having a ravenous? But why? Because खाली दिमाग शैतान का घर, खाली बैठेगा तो मारने का सोचेगा. So he will be keep busy himself while eating. खाएगा और बिजी रहेगा तो उसका दिमाग शांत रहता है. Otherwise खाली दिमाग शैतान का घर. Okay, so just try to remember. But this impulse I want to correlate with another medicine. एक पेशेंट होता है जिसको impulse आता तो अपना बच्चा भी आग में फेंक देगा. The medicine is Hepasulf and Nux vomica and Lycopodium is there. Okay, just try to remember. Another symptom, sensation as if thread were hanging down from the throat. Okay, so this is the Valeriana. Okay, and nausea felt in the throat. यहाँ पे vomiting, miss vomiting feeling is there. Vomiting feeling. Then we can think about this medicine. But if you are talking about the nausea and vomiting, this point I want to correlate with the anatomy, where this vomiting center is located in the brain. Can anyone tell?
It's a medulla.
Yes, medulla oblongata. Very good. I have already told in the Theridion while we have read. Okay. And this medulla oblongata is supplied by which cranial nerve? Can anyone tell?
9, 10th, 11th, and
Yes,
12th.
very good. 9, 10, 11. Okay. ग्लासोफेरिंजियल, वेगस एंड हाइपोग्लॉसल। ओके, कई बार क्वेश्चन आता है। चोकिंग on falling asleep, the patient is feeling choking. Okay, you can see while the patient is lying down. Okay, then we can think about this medicine. But have to choke while eating, can anyone tell me the name of medicine? Have to choke, ऐसा लगता है।
Anacardium.
Yes, anacardium. In the bracket you will find cannabis sativa. Kava kava is the
Kava
medicine. Very good. Another symptom is there is spasmodic asthma is there convulsive and movement of the diaphragm. You will find there will be a movement of the diaphragm you will find. But if you are talking about the diaphragm, this point we can correlate with the anatomy. Which nerve is supplied to the diaphragm? कोई बताएगा?
Phrenic
Phrenic
nerve.
nerve.
वेरी गुड, क्वेश्चन आता है फ्रेनिक नर्व। और यहां से क्वेश्चन एक और आता है कि फ्रेनिक नर्व का क्या रूट वैल्यू होता है, शायद T10 होता है। ओके, एक बार ये चेक कर लेना, मुझे डाउट है। T10 होता है, एक बार चेक कर लेना। एंड इफ देयर इज अ पैरालिसिस ऑफ दिस, सो क्या होगा? डायफ्राम का मोशन नहीं होगा। दो कंडीशन में नहीं होता, इधर रिब केज का इंजुरी हो जाएगा तब डायफ्राम का मोशन नहीं होता है, और दूसरा होता है फ्रेनिक नर्व का इंजरी हो जाएगा तब नहीं होता है। तो ये क्वेश्चन आता है कि इफ देयर इज नो मोशन ऑफ द डायफ्राम व्हाट कैन बी द कॉज? वन, इफ द रिब्स केस डैमेज होगा तब, और दूसरा ये होगा फ्रेनिक नर्व का इंजरी तब। ओके, green is pap bloody stool you will find. Suppose if the patient is coming to you and that patient is having a pap bloody stool if you're finding, then we can think about this medicine. But these symptoms we can correlate. If there is a black color of the stool, which medicine? Can anyone tell? Black stool, black terry stool, which medicine? Can anyone tell the name of medicine? Black terry stool. Leptendra is the medicine. Yes, very good. Leptendra is the medicine. Okay. But what can be the condition? इस condition को क्या कहते हैं जब black terry stool होता है या black stool? Melina.
Melina.
Yes, very good. Melina. Okay. बट यहाँ पे ग्रीन कलर लिखा है, तो ग्रीन कलर यूरिन किस मेडिसिन में होता है? ग्रीन कलर यूरिन, ग्रीन यूरिन, रूटा।
Ruta.
यस, वेरी गुड, रूटा। ओके, ब्लड, अब ब्लड लाइक यूरिन होगा तो यहाँ ब्लड वर्ड है तो यूरिन में घुस जाते हैं हम लोग। ब्लड यूरिन क्या क्या मेडिसिन है?
Cantheris, sir.
यस, वेरी गुड
Lycopodium,
आर्यन।
Sarsaparilla, Cantharis.
यस, very good Hina, and Maxol is also there. Lidampal is
Maxol.
also there. These are the medicine where we will find the bloody urine we will find. And spasm in bowels after food and night in bed. Okay. And pain especially in the heel while sitting. You can see if the patient is having pain, especially the patient is sitting, then we can think about this medicine. And for this symptom, there is another medicine. Causticum is also there. Agaricus is also there. And Lidampal is also there. Okay. Lidampal. Okay. But if there is a pain, especially in, what can be the cause? This point we can correlate with the practice of medicine. What can be the cause? Gout. Okay. गाउट होता है। ओके, प्यूरिन मेटाबॉलिज्म की वजह से होता है। कई बार क्वेश्चन आता है गाउट प्रॉब्लम किसकी वजह से होता है? प्यूरिन मेटाबॉलिज्म। सो इन दिस कंडीशन वी विल आस्क टू द पेशेंट नॉट टू ईट रेड मीट। इसमें अब क्वेश्चन आता है क्या चीज खाने के लिए मना करते हैं? रेड मीट स्पेशली। ओके, longing, long lasting heat often with a sweat on the face. If you're finding long lasting heat but sweat is there, then we can think about this medicine, and you will find there will be so much heat and heat predominate especially in this patient, then we can think about this medicine. Okay, now we'll talk about the relation. Compare asafoetida is there, asarum, crocus and ignatia and lac canina, spigelia and sulfur is there, but this medicine we can use for the abuse of chamomile tea. This was the question has been asked this year. इस साल क्वेश्चन आया था फॉर द अब्यूज ऑफ कैमोमाइल टी 2025 में पूछा गया है एपीजेट में. सो आंसर विल बी वेलेरियाना. और भी मेडिसिन है, सिंकोना भी है, पल्सटीला भी है. ओके. And this medicine for the heel pains, I told causticum, cyclamen, ledum, and magnum acidicum, and phytolacca is also there. Okay. Okay, thank you everyone. If there is any doubt, you can text